sir to join.
Sir is already here, I can see him.
अच्छा तो
Dr. Ramesh, are you there?
Okay. Can you hear me? Yeah, this is
yes,
yeah, good evening. Yeah, doctor.
yeah, hi sir, good evening. How are you sir?
Fine.
We're not able to see you.
Okay, what happened?
Actually, camera is off. We're able to hear you. Not able to see
Where is the camera? Okay. Now,
you. No.
okay. Just try. Now video is on.
Oh, Prophet, there is no obstruction in front of the camera.
In front of camera. No obstruction.
Did you use it recently? Was it working fine?
I just use the link. I just click the link and here.
So right now, Doctor, we are on Zoom, but event will be live on the message app and YouTube.
Okay. Can you see me now?
No, no, sir.
Oh, why? What to do then? Let me know.
Maybe you can rejoin. We have 6
Ah,
minutes.
yes. Yeah.
There is a video is there. Just video on, audio is there. Share. Time.
So you can take your PPTs, have you checked? You can check.
Yeah, this is my PPT.
Try and share your screen.
Okay. One minute. Share here. This is my PPT. And click it here. Can you
Yes,
see
sir.
the PPT?
Yes, yes, yes. Yes, sir. Sir, you have to make it full screen.
Okay.
Yeah.
Hey, 1 minute. How to make it this? Here is the beginning.
Bottom, Doctor.
Yes. Now,
Yes, perfect, sir. Perfect.
So, good evening to one and all present here. I, Diksha Gambhir from Medisage E-Learning Private Limited, a platform where medical minds unite to elevate knowledge, share wisdom, and embrace digitalization to promote patient management globally, welcomes you to our Pearl program on a very interesting topic, interventional therapy in male sexual problems and low libido. So it gives me immense pleasure to once again introduce our expert, Dr. Ritu Santwani, who is a renowned obstetrician and gynecologist, infertility specialist, sexologist, and cosmetologist, holding prestigious qualifications including MBBS, MD, FICOG, FIAOG, and ART Singapore. She is the founder and CEO of 360 Degrees Healthcare Studio, NUHS Singapore, co-founder of MAAM, and a board member of SWWC. So Dr. Santwani has been recognized among the top 50 influential doctors on social media as well. So today we have our expert along with Dr. Ritu. So he's Dr. Ramesh Maheshwari, a distinguished expert in the field of sexology, holding an MBBS, DPM, CPS, MD, and a PhD in sexology. He is a diplomat of the American Board of Sexology and a certified sex educator with advanced training in DH, from UK. So doctors, it is a privilege to have you both today with us. So now I would like to hand over the stage to Dr. Ritu for further discussion. Dr.
Yeah.
Ritu, over to you.
Yeah. Thank you, Diksha, and thank you, Medisage, for providing the platform. So, friends, a very warm welcome to all of you. Today, I am starting one new series on this platform, the 360 Healthcare Horizons, Episode 1. And today, really, we are lucky to having a stalwart Professor Maheshwari is with us. So, a very, very warm welcome to you. The motto of these programs is only the knowledge sharing. So, my other programs are already going from more than 4 years on the different platforms. And by the grace of God and my Mata Rani blessings, all the programs are rocking. The only motto is to share and share knowledge. And earlier, when I passed out 20 years back, that time the net was not so effective. So, whatever the problems, how to ask anyone, how to solve our queries, that was a big problem. Now, with the help of the platforms like Medisage, which is connecting a lot of doctors together and getting the help of the stalwarts like the sir, we are able to discuss a lot of queries together. So, warm welcome to you, sir. As Diksha has just mentioned, today we are going to discuss related about the male sexual dysfunction and as the low libido. These days we are getting lot of patients are coming either maybe due to stressful life or maybe due to some addiction. Usually I am finding the stress. Lot of male patients are also coming, ma'am, there is a totally loss of the interest of the sex. Earlier, the male patients usually getting their females that my wife has suddenly lost of the interest in the sex, maybe either due to premenopausal or menopausal age group. But these days, uh, yesterday only I have seen a couple who has come with the same problem. So, sir, we all are eagerly waiting to hear you. A warm welcome once again, sir. The stage is all yours.
Yes. Thank you, Dr. Ritu and the group. And now I will start with my PPT. Is okay?
Yes, sir. Yes, sir.
I will make my PPT on and will start. Is okay. Current slide from the beginning. Okay, fine. And this is this much. Okay, fine. It's not working as such. Okay, huh. Now, good evening, everyone. Today's topic on interventional therapy in a male sexual problem. When the patient comes to us, most of the time, they have more than 50% are having a patient with erectile dysfunction, premature ejaculation, and low libido. Day by day is increasing in up to the 75%. And if we study worldwide, population of erectile dysfunction or male sexual problem is more than population of erectile dysfunction or male sexual problem.
I'm so sorry, sir.
250 millions and more, and every 3 years it's a double. So, my dear friends, it's a vital cause in the male scenario in our day-to-day life. Interventional therapy, before that, we go to the psychology of sexual response. What our
Sorry, sir,
oldest,
slides are not visible. Sir, slides are not visible.
how to make it visible?
Sir,
Let me
you have
know.
to share the screen, sir. Share the screen.
Okay, you said ki you don't share, that's why I cancel it
No,
now.
that time we told you to stop the
Okay.
sharing. Now,
Okay, now let me know how to do it. I don't know.
sir,
Just
sir,
give me 1
see,
minute.
down there's a button of the share, green color
Yeah.
button.
Yes,
You have
share.
you have to
Yes,
click
share.
that, sir.
Yeah.
Yes.
Yes. Now is
Yes, sir.
Yeah,
Perfect.
it's
Perfect,
visible.
sir. Slides are visible.
okay, fine.
Yeah.
Now this. Okay, fine. Now how to proceed ahead? Okay, this. Okay, fine. Okay. Again, it's a problem for sharing. Just I will try first again. Let me. Is
Visible, sir. Slides are visible.
okay. And now it's a big. Okay, fine.
Yes. Yes.
Psychology of sexual response is very important things we are going to see. It's not my tab is not going to the next slide. What to do?
Doctor, you can use
Doctor,
the keys.
Keys is not functioning now.
The right side key is not functioning. The arrow key.
No. Arrow keys is not functioning. Yeah.
Maybe you can try and reshare.
Okay.
Is it full screen? It's full screen, right?
Yes.
The arrow
Share.
key should work. Actually, the arrow key should work.
Now. Yes.
Yeah,
Yes,
it's
yes.
working. It's working.
It's working now. Yeah.
Yeah, it's working. Yeah, you can continue now.
Yeah. Psychosexual stages. According to great psychologist Dr. Sigmund Freud, proposed that psychological development in childhood take place after the birth of the baby. It is in 5 stages: oral, anal, phallic, latency, and genital. These are called psychosexual stages because each stage represents the fixation of libido, roughly translated as sexual drives or instincts. According to Dr. Sigmund Freud, after the birth of baby, from 0 to 1 year is oral stage when the baby learn or pleasuring from eating and vocalizing the breastfeeding. If anything disturb in this stage, then in adulthood, that may affect their excitement factor. If the age is 1 to 3, anal stage, pleasuring from retention of repulsion of feces. That is a anal intercourse. Most of the, in the gender identification, more than 20% are homosexuals, lesbians group, bisexual groups, and 80% are straight heterosexual. So that times this stages is effective according to him. And phallic stage is 3 to 5 year age, and 6 to 11 year age is identification with the same sex with the parents. So in this age group, parenting is very important. Mother and father should be in the loving mood, must be hug each other, and they should not be fighting things before the eyes of the child. If this happens, if there is something wrong, then at the age of 12 to 18 years, is a heterosexual attraction will be remain constant. Otherwise, it affected according to psychosexual development. But there is a why they are homosexual still the scientific reason unknown. Once you know oral, anal, phallic, latent, genital stages, that is based on the ego development and super ego development of the child. And Sigmund Freud had done a lot of works. And according to him, what we added in our routine medical OPD during the history taking, love mapping. What is love map? It's very simple things. When we had to ask after that, it's developed before the age of 8 years. What we have seen just now, according to Sigmund Freud, 8 years, and it's executed after the puberty. So always ask the patient whom you had the first crush. If he said opposite sex, then it is a heterosexual, no doubt. If he said mom or don't say anything or he's doubtful, then consider he may be homosexuals or bisexuals. You have to then evaluate by the various questionnaires and all. This is the only history taking we added in our institute during the training program. More than 400 doctors we trained under the institutional membership of American Board of Sexology. Then we go ahead. The story is that before 1965, everyone felt that male are active, female are passive. Master Johnson changed the scenario. He said, no, male is active, female is active. Desire is equal in male and female. Then in male, if we study the psychosexual cycle, male get desire, then erection, then rigidity, penetration, and then ejaculation, then orgasm. In female is desire equal. Instead of erection, there is expansion and there is a secretion of more and more secretions in the vaginal fluids and all in females, and they get orgasm. According to him, excitement phase, plateau phase, and orgasmic phase and resolution phase, female get orgasm after orgasm. That you have to remember here. Why? Because female sexual organ is the clitoris. Because if we study baby in the womb of mother during embryonic stage, whatever tissue used for formation of sex organ like a penis, if it is round tube, then is a male baby. And same thing is from clitoris. Means clitoral stimulation is very, very important factors. We forget about this. That's why most of the female is not enjoying the sexual act the way they should enjoy. So always remember, they must go for foreplay and clitoral stimulation. Because if you get the patient will say, sir, I get the erection faster within the 10 seconds and ejaculated, and then there is no erection, because resolution time varies in the male from 2 hours to 3 hours to 24 hours. And female get orgasm after orgasm. She needs the sex. Her demanding is more and more. Then how to fulfill this demand? We need the timing of the timing is very, very matching. So what you have to do in such cases, you have to advise them, counseling them properly, and use them the techniques of how to go ahead slowly and steadily from the side of male so that time will match an orgasm. Hormonal, about the hormones in the sex, you know very well, male is a testosterone and female is the estrogen. But always remember, both the hormones are secreted in the male as well as in female. So we are going to see why the libido caused because of testosterone reduce and sex drive controlled by the testosterone. And if your patient is overweight, what happened? The estrogen secrete in the male and testosterone reduce. So you have to ask for the total testosterone level. If it is reduced, means what? He is a libido, low libido, and his lack of interest. Why it is so? Sometimes orgasm. Whenever a patient comes to you, one younger age group, always consider psychogenic origin up to 25 years. 25 to 40, 50 year age, always consider organic cause. Maybe first diabetes, overweight, diabetes, blood pressure, or first diabetes, then blood pressure, first blood pressure, then diabetes, then renal failure, and such story goes ahead. And that affect the interest, lack of interest. That you must gain the interest. Then what you have to do along with this, at that time, most of the time patient comes. I have seen 32,000 patients. I will show you my slides, future slide on the practice and all. Most of the time patient feel that they have lack of interest, they don't have the interest. And how to develop this interest, we are going to see from our future slides. History taking is over just now is the similar what you are doing routinely. We added only love mapping here, and their overweight, the BMI and BMR, you have to find out by the various app available, Android app, you take it. And if BMI is between 18 to 24 is normally more, then you have to reduce, or that how we are going to see. Now, before that, our Sexology Institute is just the story. In 2017, we formed our WHO clinic into the WHO Healthcare Private Limited, under which we started Sexology unit, and that we need some because this is not taught in the medical college as routinely. So we need some institutional membership. We had tried at best to get the institutional membership, and we had institutional membership from American Board of Sexologists, and most of the things and concept are clear when we go through their various books and literature. Then at the being an Aditya Birla Memorial Hospital, being a senior consultant sexual medicine, I was visiting regularly there. Now, because of my this heavy practice, I've reduced the days, but I'm there attached. There we have around 2,000 cases we have studied in the low intensity shock wave. What is a low intensity shock wave therapy? Is nothing but the waves are passed through the high. This is corporal. Sound waves are passed through the penile shaft to revascularization, because whatever in the blood vessels having calcium deposit, cholesterol deposit, that will be removed gradually. Weekly basis, we advise 4 sittings once in a week. Then if patient having 60 to 70% improvement, then we advise them once in a 15 days 4 sitting, and once in a month 4 sitting. That effect may remain up to 1 year, 3 years, 5 years, like that. Along with this, we have the various groups with the oral sildenafil and tadalafil. Sometimes we use the tadalafil in afternoon and sildenafil, because tadalafil need time 8 to 12 hours to get the effect on the bed, and sildenafil effect is faster, and then 2.5 hours before you can advise accordingly. True drug you can give very easily. There is no, these are my 32,000 cases on Practo, and most of the doctors come today, they open the file and they study the things, how we treated and where we got the success and where we are failure. And the consent letter is very, very important in each and every case. And these are 800 patients we have taken for trial, proposed, because out of this 2,500, and that is the age group from 30 to 70 years. And there is we use this shock wave, energy level is 10 joules, and actual target waves are 1500, and frequency is 4 hertz. And there is introduced in the corpora of the penile shaft, and is given in the straight way, and view is safe at the base. And most of the time, what happened, doctor make the mistakes, or those are giving the shock wave, they provide the shock wave to the testes and testicular damage, and that leading to oligospermia, sometimes sperm count even 0. So please take care that don't give the shock waves to the, that's why we kept it just like a partition or some thermocol sheets along with the paper for every case, to keep it and then provide them waves therapy. After wave therapy, you can advise the wave therapy along with this, because this reduces the calcium particles and other things is diluted. And now you have to remove this, so we need the blood flow. Then we give the tadalafil in low dose, 2.5 mg alternate day, because its effect is 24 to 48 hours, you know very well. And vacuum erection device exercise, everyone knows you are using very frequently. Be careful, don't more than 3 to 5 minutes, otherwise there is a paraphimosis, and again you have the puncturing or other circumcision operation needed sometimes. And various drugs, sildenafil, tadalafil, vardenafil, udenafil is not effective. Then the patients want girth should be improved. The girth for, we are using the platelet-rich plasma, where the growth factor is more, and that is injected on the penile shaft. How to collect, how to do, I'm not going in details, because time permission is according to I have to complete in my time phase. Thus we go ahead after giving the renal block. This is a penile block or ring block to the penis, and application you can give the injectable very well. We use the various injection, even papaverine, prostaglandin injection, mixed by mix, trimix. But priapism is a very common, so be careful. Don't do your own OPD basis. Under institutional stage, you can do it. There is, we added various meridian stimulations because it's a TCM. Because more Chinese medicine said whatever organs inside the body is represented in outside in the lining form is called the meridian. If you treat the kidney meridian and urinary bladder meridian, that helps a lot to cure the patient. And I had 3 to 4 months treatment. We provide under our startup. We prepared this unit indigenous from this company, Indian company, and they manufacture it, and they have just we given to our patient more than 1,000 patients. We tried it, very helping it in the base of acupuncture science. Now, these are the gadgets, very contraindication, indication, everything is mentioned here. We are using very frequently this gadget. Erotic zone stimulation is very important. Whole body is erotic, but here kidney meridian, urinary bladder meridian, even ear is a very sexy part. You just small bite to the ear will get excitement because ear is the center of all meridians passing through according to TCM. And nose is a very important factor because all meridian goes to nose. Nose touching will helping most of the patient. Exercises are well helping to a lot of patients. And when everything is normal, most of the time, posture therapy is needed. Because patients say there is infertility. Most of the gynecologists feel that what to do in such cases. Take the sonography of uterus. You will find the normal position of uterus or retroverted. If retroverted, doggy pose. If anteverted, keep the pillow below and have the intercourse. Psychoneurobics is very important. The stimulation of the various nerves to get the desire to increase naturally inside the. For that purpose, I'm taking now, this is the one unit where I'm getting the particular frequency for aging purpose. I'm using it aging and various fitness and various frequency you can take it. And this German made, and that is a quantum healing. That is nothing but the pranic healing, oldest yogic procedure. That is various mantras affecting on the body. Om, Ham, Yam, Ram, Vam, Lam. These mantras are when you do these mantras with the sound, this is ball and sound, that give the tranquilizing effect, and that effect with stimulating the part of the body, and that will again affect for stimulation of erection and erectile and helping in low libido cases. Now, this much, no doubt, I told you, testosterone, if the overweight, low libido, erection problem, decreased muscle mass. If the body testosterone is normal, just fit body, strong erection, decrease fat mass, increase muscle mass, and mental focus more, and these things. Clitoral stimulation is much each and every case. Teach your patient first so that they will be happy in your medicinal life. They require less medication. Personality evaluation also very important. Extrinsic part, intrinsic part, personality is very, very important because most of the time, most of the psychologists done work. They said there is no ideal woman as a wife. There is no ideal wife or ideal husband. You have to make the relationship ideal. So you have to balance the personality. So each and every case, we find out the personality evaluations, questionnaires, and we find out suppose husband is powerful and wife is peaceful and perfect. Then we make the wife to be peaceful, powerful should increase so that they match with the husband. If husband is peaceful, vice versa, like that. There is a scoring of powerful, peaceful, perfect, and accordingly we advise them and counsel them. And this much we have already completed our WHO Institute of Sexology Institutional Certification. First time we got it. Our startup is just registered, recognized. Various authors have done a lot of work on this. And my 42 publications on Amazon in the form of book, because these all are from my students. They help me a lot and put it everything in the books form, and they are now available in these things, and that is helping. Very nominal, $5, $10, $2, but it's not easily available in India. It's available in US and all. Whenever I go to US, I bring one copy for me. And functional nutrition is very, very important factors. What to eat, what not to eat, to reverse your diabetes, reverse your blood pressure, reverse your obesity. If I reduce my weight 10 kg, my blood pressure medicine is reduced to half. My diabetes, I want to be reversible diabetes. If you consider reversible process to your each and every case, then and then you can cure the prolonged effect for your patient. Otherwise, there is no medicine, no gadget, nothing will help. Lifestyle modification, it will help you. What is health? Everyone know. I'm not taking much time because time duration is very. I want middleman like that. 18 to 24. That's like 6 packs pattern. Physics is very important. What you eat is based on physics. It's a medicine. Eating food is a medicine. Always remember, my dear. Health, fitness, physics is very, very important. Fitness, we need the exercise. Aerobic and aerobic. Anaerobic is what weight exercise. Your muscle tone is very, very important. When you see the Kapil Sharma show, and this heroine, well-known, Hema Malini comes, she said, I'm doing, along with the diet, this weight lifting so that I'm young. Why you are old? Can you think why we are old? Because every 10 years, male reduce 2 to 5 kg of muscle mass, means protein, and female reduce 1 to 1.5 kg. If you miss this, if you give the proper protein to your part and with the weightlifting exercise, then you become younger and younger. Young is very, very important. Cosmetic look, need that things. If cosmetic look is very important. If it's not good looking, then how you stimulate your partner for your sexual act? That is very important. The focus should be on fat loss, not the weight loss. Weight loss you can even disease. Weight loss is fat loss is important. Always average man loses 2 to 3 kg muscle every 10 years so that they become older. Also, so you have to prevent that by proper diet, proper exercise, proper nutrition. Means everything is now we are going to a natural therapy, naturopathy, alternative therapy, yoga therapy, whatnot therapy. But that is a very important factors. If time is more, that give me a reminder that otherwise there is a lot of slides with me, but I'm not taking your much because low glycemic index food you have to try to take. Now, I will tell you, glycemic load, what you eat is absorbed from your gut, is a glucose form, it go to the liver. How it goes, and it's like here is the liver. Liver use 100 grams of protein, and remaining 500 grams protein, your fat, mass, muscles, everywhere. Suppose you eat excess, all the glucose is deposited in the form of fat in your body. That's why we advise reduce the glucose, reduce the carbohydrate. Increase the protein, reduce the fat, increase the vegetables. That is the basic formula. If you keep this in their mind, subconscious mind, their behavior change and their eating pattern change, and patient himself improved, they reverse their diabetes, reverse their blood pressure, reverse their obesity, reverse their kidney problem, and they are normal. Now, my dear friends, this take the lipid profile protocol of every patient above 40, there's overweight, you feel the total triglycerides, suppose here is the total is 208 divided by high density lipid HDL 35, that ratio should be less than 3. Here is 5.7, means he's prone to be cardiac problem in future. So advise them, oh Baba, you will get the cardiac problem, you get heart attack, anything will happen wrong to your body. Take care. So he can understand, now I want to take care. So he can survive up to 100 years. Otherwise die within 60, 40, 70, whatever. Now I'm not taking much time. Number of things with me, but it's the time limitation is very important. Though we just go ahead, and we'll see what happens. See, reduce because of the film actress. He want to increase the weight, reduce the weight on the same basis. And if you study them, all the film stars and all. What should be the percentage of fat? for the normal testosterone, normal body is 12 to 8 or 15 to 8. 20 is okay. What? But if 25, 30, then it is prone to be disease factor. So reduce the fat mass, fat percentage in the body. In female, fat percentage is more because there are more fatty part on the breast and other hips. So may require 5% more than the male. I'm not going in details, but you should giving an idea about this home message is that you know, not the medicine is cure, not the gadget is cure, along with the lifestyle modification, exercises, management, other management, frequency of energy is very important, and all this will affect you. Now we will go ahead, training exercises, you know, all, I'm not taking very much time. Functional, there are various type of food part. I went to the US, I always visiting by my son and daughter. Daughter is in Canada, and mostly I visited there. For this 5th time I'm visiting again. And at the time we have meet some my sexologist friends and other doctors and all. They're a vegan restaurant. Means they only eat the vegetables. Lacto-vegetarian, they eat with milk added. Vegetarian, they added with vegetarian with eggs. Pescatarian, they added with above fish. Non-vegetarian, they eat all everything. In non-veg, you know very well. Why they like that? Because sympathy toward the animal, protect from hormonal diseases passing through the animal milk to the body, free from over fatty food, lower calories, high fiber food. That is the only motive of these things. Exercise needs stamina and all, you know very well. Try to walk at least 10,000 steps in a day to keep yourself fit, reduce your blood pressure, reverse your back. If you reverse your blood pressure, diabetes, obesity, you will become younger. Nobody, that's why we are saying 18 to 80 year age, you can perform. Otherwise, you can't. Now, various diet pattern is over. And that is a different books are there, very little. I will pass on all the literature if you want. Dr. Ritu, I will send you all this PDF to you. You are given me opportunity to present myself, my 30 years, all the research work or my time I devoted to various factors and learn. And even today is learning. This is the way we are here. And I'm very happy that we can do the best for our community. We are not asking any these things. Now, we had to do, because of startup, we had to do some corporate activities. I announced one activities, we just think about one month back, and we are working on that because we had all the data about reversible of diabetes, reversible obesity. We reduce the weight, even 50 kgs in 1 year. So what we will go through it, and at the last slides, I like to, because I want to complete in a time duration as 3 minutes more. I will complete it. Last slide will go, and we'll end our today's meeting. Just I'm thinking about the last slides. Okay, where is? Okay. Okay. Control and we go here, control and then I will try. Okay. This is our last slide. That the WHO Wellness Preventive Care franchises with the zero investment to all doctors are eligible. Medical graduates, psychologists can use get one board. Them reversible of diabetes, reversible of asthma, reversible of obesity, reversible of diabetes, blood pressure, and so on. By all medicinal part, you will take care. Only diet, exercise, various sound healing, other techniques, quantum healing part, we will teach, our team will teach them. And this is the way we are planning to start thousands of franchises all over pan-India basis. That is my motive in future. I'm very thank you to everyone. those are here, and you are pleased. If you are anyone interested, just write down me one your consent letter. We will send you all the details with the board, and you will start the taking a meeting every Sunday for 2 hours. We will spend, our team will spend that, which include dietitian, yoga teachers, sound healer, and quantum healing, meditation, and every psychologist, everything, everyone we added in that. And we just starting phase. We are planning in future to best. Thank you very much, Dr. Ritu. You had given me time, and thank you, my loving audience. You have taken some message to weight reduction is very important things. Diet control is very important. Portion is very important. Reversible of your diabetes, blood pressure medicine, so that I reduce 5,000 medicine, I have to take 1,000 rupees medicine in a month. So if I can reduce, why not you? So that's the things. Everybody can change their disease pattern on lifestyle modification. Thank you very much. Thank you very much.
Thank you. Thank you so much, sir, for such a nice and elaborative presentation. Sir, will you please stop sharing?
Oh, okay. Thank you. It's just 1 minute, 1 minute.
Yes, no problem.
Okay, fine. Yeah.
Sir,
Now is
sir,
okay?
Yeah. Yes, perfect, sir. So very nicely you have covered all the things. Sir, as we had gone through the presentation also, sir, the patients were coming to us with the complaint of this low libido. So what's the role of this hormone replacement therapy according to you? Is it any role? Because these days the patients what we are getting, they are already searching a lot of things in the Google and then approaching us and asking us directly about the testosterone replacement therapy. So do you
you
think
can
it is
use
useful and how to
above the age of 40 years, you can use, because before that they may affect their sperm count and all. It is better above 40 years, you can give twice in a month, 250 that the testosterone depot injectable available. Once in a month, we are giving 3 to 6 injection, then we stop it, and we advise them to diet and this pattern to reduce their weight and make their testosterone naturally boost up. That's what we are taking. Clinic.
Okay. Yeah. Thank you, sir. Sir, along with the testosterone, is it any role of the HCG injections also you find?
Oh, yeah. Most of the people are, when the student comes, they are using it. I not use so frequently, but they said they're helping.
Okay.
That a month is okay for that injection. Once in a month, don't exceed more. According to them, 3 to 4 injections they are providing like that. I'm using very less. I'm using more on natural and other things, factor, acupuncture and other things. I'm taking more interest in that.
That's great. That's great, because for this holistic approach also, a lot of patients are also easily agreed. While giving this other supplements and nutraceuticals are okay, but while giving the hormones, all the pros and cons has to be remembered. Sir, coming to another point, as for the low libido we have just discussed, sir, regarding to, I have seen in some of your slides related to PRP. So do you think this PRP shots, the penile shots and testicular shots are really helpful? How you find the results?
I did in around 70 cases. It's a more effective on psychological basis. Patient feel that I'm getting girth improvement. I'm improving. And most of the time, if you study most of the doctors in various faculties, like even you may be using other facial rejuvenation or scalp and the PRP. So there is no harm because it's our own. But the frequency I do once in a month, not more than once, or once in a 3 months. I advise it to my patient, not regular basis.
Okay.
But that helps.
Thank you.
Helps up to a certain extent. The patient also improved very well for the erection improvement, premature ejaculation, according to them. That is also one finding. In the shockwave therapy as well, we combine shockwave therapy with PRP together.
Okay. Yes, of course. If we give the combination, the shockwave therapy, PRP, and as you have mentioned very nicely, the role of the diet and change of the lifestyle, that all plays a good role. If we give all the combination, of course, the results will be much more better. Sir, coming to the another question, The question is raised by our Diksha. Diksha has just mentioned this.
Yes.
Uh, Related to that, what are the long-term efficacy and potential risks associated with shock wave therapy for the erectile dysfunction?
There is no side effect of the shockwave therapy. So far, I did around 5,000 cases. Even
Okay.
one patient come to me from Canada. What he is
Huh.
using some collagen supplement in the gym, and collagen is deposited there, and they get the curve pain. It's like peyronie, these things, peyronia pattern. And they said, previously I was my wife, I can perform with the wife, but now wife said, you can't perform, you can't introduce. Can you help me? He's tried. Most of the dermatologists tried here. What we are using injectable in the keloid injections. That
Yeah.
same thing is given there, but is not used in Canada. He came to me. He was knowing by this by some friends and all, and he stay here because he has to work in India. He is from Pune based, and he has taken shockwave that time 25. And he can say, okay, now I can perform. We take the photographs, erectile photographs of the penile shaft in every shockwave therapy. After every shockwave therapy, what is the change? What the curvature? Where is the curvature? Where you give the shockwave therapy? That is just training. That is just for educational point of view. He insisted me, and we did it. How much really we don't know that when we started, but he has improved. He's happy. And one case also, I forget to tell you. One divorcee case comes to me. He said, "Okay, we divorced, and on the ground of the erectile dysfunction, penile Doppler test indicate the arterial insufficiency. Advice recommended by urologist, penile prosthesis. But I don't want to do the prosthesis. And what to do, doctor? Will you help me? Okay, I tell my time duration, minimum 6 to 1 year, because nothing will be happen if you come for 1 month and go, that will be useless. He will, okay. And at that time we use the shockwave therapy, this TCM, that meridian stimulation gadget, we ask him to purchase and do it at home daily, regularly. And along with this, we use multivitamins and other things, what we are giving for the selenium, zinc and all together to these things. And he don't want to be take pills and Viagra and other things. And after 6 months, he said, sir, I'm getting some improvement. And now I want to marry. Well, you see, if you want to marry, be careful about the age factor. So, well, I got my friend and I want to marry. And he said, now I have the baby, sir. Thank you very much. This is a story about that. So it can be helped, but we can't say one patient is the cure for all. But those who don't, he said money is not factor. I can pay 5 lakhs, 10 lakhs, but I've seen after the processes, they remain erected and I don't feel good. Every time office I'm going and it's erected and things, I don't like it. So he did it and he got the results. The multi-therapeutic approach is very important. Meridian stimulation, acupuncture therapy, in short, we can't freak every case and have no time. We teach them and do it at home. We teach them, do the dietetic pattern. We go this thing, and this is the way we leave to the patients itself, so that they will do it their own. And that's why consent letters is very, very important.
Very
Every
true. Very
case.
true. Yeah. Yeah. So thank you so much, sir. Sir, my last question to you, sir. These days, some patients who are approaching us for this low libido and for erectile dysfunction, they have seen in some platforms the vibrators are available, or the small handy shockwave therapy instrument is
Yes.
available. So they are using by themselves. So
Hmm.
what's your opinion on that? How safe they are? Hmm.
And there is so long it is no medicine, they are not doing any problem to themselves, then it's okay. It's not harmful. But what we are doing, we are giving the medicine. Medicine is a
Yes.
temporary one. They don't want the medicine daily. That's the problem with each and every studied. In Pune is a very common because our IT sector is much more. And
Yeah.
I'm happy people understand the things and they give the good reviews also. No doubt there is mixed review, but 90 out of I got 80%, 85% good reviews because of only weight reduction. What I do, I said, okay, एक क्या करो, एक मुट्ठी पर मेथी दाना लो. मुट्ठी पर means जिसमें. He
Yeah.
take the mutti par
Yes.
methi dana, he put in water, dip in water, and use morning and evening. So I reversed my SBA1C was 9, now SBA1C is 7. It's not reverse anywhere. My medicine is I'm now reducing. This is the way. What's the story? So there are even herbal things, whatever in our kitchen can be used effectively, but it will be suitable for each and every case. I can't say. We can't may get acidity or someone some. He's just I told him कि just I what come in my mind I don't know. मुट्ठी पर ले लो डालो. पर कितना खाना. I was so much headache and all. And they मुट्ठी पर
Okay.
ले लो.
That's
He said this become medicine for him.
that's great. That's great. So sir,
And
ऐसा
these are
कह सकते हैं ना कि अंत भला तो सब भला. So you have told them as a मुट्ठी भर ले लो, but of course the results are coming, then it's very good. Of course, as you already mentioned, we all advise in the diet to include the products which are rich in arginine and citrulline, the watermelon, garlic, dark chocolate, and of course the fenugreek. So that's a really a good take-home message. So there is one more question in the chat box, that what are the risks and benefits of using intracavernosal injections and how do they compare with oral medications?
It is a very risky because priapism is very common. I have seen the priapism case. Then you have to do the decompression operation, and every penile shaft is totally lost. So it is a very careful. And there is fibrotic condition where you can't repeat again and again. Elderly case above 70, 80 like that. उनके लिए ठीक है, is okay. But don't do for younger age group. I'm not in favor. I'm not in favor. Risk factor and
Okay.
all.
Yes. Sir, similarly, what's your opinion? Because once the young guy or the middle-aged guy is having this problem of loss of libido or erectile dysfunction, they themselves over the counter, they will go and start taking sildenafil. They go to the store person and they advise them for the depoxetine for this because I am also dealing with the corporate patients. So they once they approach me, already they have taken so many things. Yesterday was one patient, he
Yes.
has taken the tadalafil, levenafil, everything,
Yes.
depoxetine
Yes.
also. So what's your opinion on this?
But I will suggest low dose of tadalafil 2.5 mg along with the training about the foreplay counseling part.
Correct.
And what the imagination? Sometimes they imagine somebody want like the tall woman, somebody like short woman, somebody want big breast, chest like that, somebody like big nose, and such type of stories comes to the patient. Some want the one patient come Muslim. I want the Muslim girls to have these things. Sir, how to go ahead? Otherwise, I can marry. But we can't provide these things. You have to do your own. Whatever you want, you do it. But this like or dislike is the patient mind. That patient has to develop his own. He has to close your eyes, imagine someone, and then perform with your partner. Otherwise, take love making and emotional factors gradually developed, and they can perform very well. That is the only solution. Satisfaction is because expectation is increasing day by day, that leading to frustration. And what happened in male factor? Male factor is always irritating the female whole day, and they're asking in night have the intercourse. How it is possible? So if they must caring about the female part. Female, what the female needs, what the male needs, they should understand first. They forget everything. That's why these are the, they are multiple. They are nowadays, they are in live-in relationship. Sir, मेरा दूसरा breakup hai, तीसरा breakup. Both are coming and saying, my boy, the first boyfriend is performing very well, but he is not performing. Make him. It's not possible. This is not the machine. You have to make the everything emotional factor, what he like, dislike, what are the things, relationship, interpersonal relationships, other things, your mindset, your personality evaluation. Yeah, I will tell you one formula, what I'm using very frequently. Ask any patient coming to you, which two colors you like most out of 4 colors. Take 4 color, red color, remember for powerful. Yellow color for popular personality. And you get the popular personalities, characteristic on the Google and everything. Green color for peaceful. And sky blue is perfect. So why the perfect? When we die, we go to the heaven in the perfect, the sky blue. Suppose the patient says, I like sky blue, I like blue, I like green, means he's a peaceful and perfect and powerful and peaceful. His husband, then mismatching. You have to match the mismatching according to you advise them and ask them the weakness part. Every person having a 4 personality compulsory. God has given. 2 is a dominating personality. God gift, you can't change it. So what I'm here maybe my powerful personality, a popular personality. You are here, you are popular personality, so that you are here, you are taking the interest for the community, for the best for the others. No doubt. These are the things, your personality take you up. Nobody will take you. That is very important. You just read the personality evaluation. I will send you, madam, my personality evaluation and what we are giving to my, and that you go through it, you will enjoy. And this personality, then dominating, you can't change. What you change? Weaknesses. Improve the weaknesses. If suppose he is not peaceful, ask him, do the meditation, do the relaxation, be cool with your wife. Understand, if you have any anger, control that you feel you have seen. Control. Just this control karo. This is control it. It's a very important practice. But
Correct.
that is need. Practical approach is a very different little bit, but scientifically we can add on these things together.
Correct. So thank you so much, sir. Actually,
Yeah.
program time was scheduled to half an hour, but we are almost completing the 1 hour. Very informative and so many nice take-home messages. So I request Diksha that we will wind up by this now. And thankful to Medisage and thanks to Diksha, Karan and Akash from the Medisage platform, because once they told me, I told for me the doing the webinar 9 p.m. is the best time, because once I come from the OPD and we can discuss properly. Otherwise, all the time there is one or the other obstructions, hurdles in between. So,
Yes.
so thank you once again, sir, for sharing your immense experience with all of us. With this, we will wind up for today.
Yeah, thank you.
Thank you, Dr. Ramesh, for answering all the questions so much in detail, and the concept was definitely explained very well. So now it's time that we move towards the closure. So I extend our heartfelt gratitude to Dr. Ritu and Dr. Ramesh for your invaluable time and presentation on the topic interventional therapy in male sexual problems and libido. So the session was truly exceptional, brimming with knowledge and engaging discussions. And we trust our audience found the webinar both enjoyable and informative at the same time. So we look forward for more such webinars on equally fascinating and educational topics in future as well. So any of the audience members have missed this session by anyways, so you can just tune into the past section and watch the entire program again. And after 24 hours, you will find the edited version of the same in the video section to watch as per your convenient timings. So thank you each and everyone.
Diksha, I request you, please send the this link to me also. I have the 100 doctors group. I will send them also.
Sure. Once the video is released, I'll hand it over to you.
Yes, thank you very much.
The Medisage link, what I've shared you now for the audience, the Medisage app link. So the video has gone on that app also. The link what I've shared with you for the delegate joining. So that video is easily accessible to each and everyone. You can share meanwhile that link till they are sending us the link.
May you edited link you send. That is the proper way, because
I will share the video link also, the edited version. For your convenience.
That is the best.
Thank you. Thank you, doctor. Thanks for joining.
If in future you want such type of lectures, you always ask me for preventive healthcare. I'm there. I will do from my heart.
Doctor, to have you today with us.
Sure. Okay, sir.
Thank you, Dr. Ritu and Diksha, both. You have taken interest and presented very well and given me opportunity to present such a video. Thank you.
Thank you, sir. Good night. Bye-bye. Bye-bye, everyone. Good night.
Bye.